Hello, and welcome to Global Data Themes Instant Insights. At Global Data, we define a theme as something that keeps a CEO awake at night, as businesses that invest in important themes will succeed, and those that don't will fail. Hello, and welcome to Instant Insights. I'm Emma Taylor, and today I will be talking to thematic analyst Jemima Walker in Thematic Intelligence as part of our new Tech in 2030 series. This series is based on our new Tech in 2030 report from Thematic Intelligence, which you can find on the Global Data Report Store or click the link in our bio. All of our analysts will be answering questions about the future of their industry and what it will look like in 2030. Today, Jemima will be talking about the future of healthcare. Hi, Jemima. Thanks for joining me.
Hi. Thanks. Excited to be here for the first time.
Great. So, Jemima, healthcare. What can we expect healthcare to look like in 2030?
So in simple terms, it will have fully digitalised. But to understand how and why, it's really important to first get a greater understanding of the sort of landscape. So firstly, you've got to understand that the global population will have quickly expanded, especially in India and Africa. And many developed countries will witness aging populations. For example, in Japan, 3 in 10 people will actually be aged over 65 years old. So together, these things will create a higher demand for healthcare services, as patient populations will be larger, especially for chronic conditions and age-related diseases such as dementia. So providers will really need to cater for this higher demand and increase access for all worldwide. So the effects of all this, they will have to invest more in health tech, and especially health tech that can ease the burden of aging populations. Even if the cost of technology is relatively high in 2030, they will still invest. If they don't, those systems could buckle under the increased pressure, especially as we continue to see a shortage of healthcare staff.
Yeah, it's a terrifying thought. So what will this digitalisation involve? How will it have changed from the perspective of the patient?
Well, firstly, telemedicine will be a common component of most patient care. It will give a wide choice of on-demand appointments, and for elderly patients, it will really remove the need to travel to visit a healthcare site, and it will reduce the length of hospital stays. In terms of sort of virtual care, we'll have digital therapeutic products which have been clinically approved, and they'll play an active role in disease treatment and management, and also in just improving health function and prevention, particularly in neurology. And healthcare providers and payers will widely adopt remote patient monitoring so they can keep a track on how the patients are doing from the home. So, for example, with elderly patients, they can be alerted in case of an emergency, such as a fall or a cardiac arrest. This could also alert sort of family members and friends. And similarly, smart home devices such as smart mirrors and even smart toilets will diagnose diseases at a much earlier stage than they currently are, thereby improving the care that's offered. And finally, in developed countries, robotics will be regularly used for sort of the care, like emotional support of patients. There's an example of a baby fur seal robot that's been clinically approved for this use. So, yeah.
Wow, a lot of interesting stuff in the home there. Having your toilet wear your doctor's coat is definitely a fascinating prospect. What will this digitalization and future care look like from the perspective of a doctor and a nurse? Like, what's it going to look like every day for them?
Well, it will basically mean that healthcare practitioners can keep a better track of their patients' health with electronic patient health records. These will be secured with blockchain technology, and AI will be used to drive insights and to support clinical decisions, such as the length of hospital stay. Healthcare sites and even vehicles will be connected with 5G networks, and in China, even 6G. So the EHRs electronic health records, will be available at any location. For example, a paramedic in an ambulance can see a patient's history that was collected from their smartwatch or by their GP. So these will mean that the 5G networks will also mean that healthcare staff can collaborate remotely. For example, there'll be increased precedence of remote telesurgery. And on the topic of surgery, robotics will regularly be used to perform complex, minimally invasive surgery. And even micro robots, smaller than 1 millimeter, will be used for those really complex neurosurgery operations. And obviously, the surgeons themselves will actually have been trained using metaverse-enabling technologies. This would be really good, especially in remote regions or countries which are lacking that sort of really expert surgeons in certain areas. So essentially, all of these technologies will help to improve access to better healthcare, and it will really make sure that we put the patient first.
Wow, sounds like it can't come soon enough. Thank you, Jemima, for those instant insights. Thanks for listening, and from us in Thematic Intelligence, see you next time.